So in the internal feature, we got first going to start with the gray matter of the spinal cord. So I would request you to draw it more toward the left side of the page, guys. If this here, once again, I'm drawing the transverse section. Here is a dorsal horn. At some places we have a lateral horn, and of course this is a ventral horn. I'm purposefully drawing this gray matter a little large so that I can clearly mark the nuclei inside. It may not be as large as it looked like in this picture everywhere. Just make sure when you draw it, guys, you should be able to show these horns. There is a dorsal horn, ventral horn. स्टक हो गया यार ये फिर से. यहाँ तक एडिट कर लेंगे इसको. So this here is, guys, the dorsal horn of the spinal cord. I'm writing in short that is dorsal horn. This one is the ventral horn, and here we got the lateral horn. So just make sure to write it on one side only. Dorsal, ventral, lateral horn. Well, we all know that dorsal horn is sensory. So the nuclei which will be present in this region here, in the dorsal horn region, they must be all sensory nuclei. Ventral horn is motor. So whatever nuclei will be present here will be giving rise to the motor nerves which will go out. And lateral horn, wherever they are present, they are autonomic. So either sympathetic nerve will come out from there or parasympathetic nerve will come out from there, depending upon where we are looking at. So starting with the dorsal horn, which is, keep in mind that is sensory. So we have three main nuclei to be seen there. One is very much at the dorsal aspect here. Then we have this one huge nucleus there. In fact, the largest nucleus of the spinal cord. And there's another nucleus which is slightly projecting toward the dorsal column. It is slightly projecting toward this dorsal column. It forms a bulge toward the dorsal column also. So these are three sensory nuclei, obviously sensory because they are in the dorsal horn. And if I may ask you guys, which part of the neural tube they must be derived from? What is the part of the neural tube on the dorsal aspect? That was the alar plate. So they are derived from the alar plate. They are the sensory nuclei. The one that I marked here is called as substantia gelatinosa. That is substantia gelatinosa. Then we got this nucleus proprius. You can note that separately, that nucleus proprius is the largest nuclei in the gray matter of spinal cord. Largest. It's a big nucleus. It's the largest nuclei in the gray matter of spinal cord. And then this nucleus, see how we name this nucleus, the one that I marked right now. You can see a part of this nucleus, or slightly this nucleus, is projecting toward the dorsal column, where the dorsal column tract is present. So we call it nucleus dorsalis. We call it nucleus dorsalis. That is nucleus dorsalis. Substantia gelatinosa, nucleus proprius, and nucleus dorsalis. Now, what is the point of why do we have these three nuclei? When we look at the sensation coming from outside, if you think about the skin or muscle or dermis or whatever, the type of sensation coming out there is like pain, temperature, touch, pressure, vibration, stereognosis. So all these sensations, when they come from outside, they first will come through the dorsal nerve and they enter into the spinal cord and will go into the dorsal horn. In usual case scenario, they go into the dorsal horn. Once they reach the dorsal horn, they're going to relay those information in any of these nucleus. Like one example, if I take, pain and temperature will come and will relay into substantia gelatinosa. So the function of the nerve is to bring the pain and temperature, and it goes into substantia gelatinosa in the spinal cord at different level where it is coming from. You have substantia gelatinosa present throughout. Now, from the substantia gelatinosa, the second order neuron will start. A new neuron will start from your substantia gelatinosa, which will come into the white matter of the spinal cord. This whole thing is white matter. Will come into the white matter of spinal cord and then will ascend upward to reach the brainstem and even further up in thalamus. And that is the one which is giving rise to the tracts. When I say a tract like spinothalamic tract, lateral spinothalamic tract is carrying pain and temperature. So that doesn't mean that the pain and temperature will come from outside, goes into spinal cord and directly continue as lateral spinothalamic tract. No, it is not. Pain and temperature comes from outside, relays into the substantia gelatinosa, and that is the end of first order neuron. The second order neuron will start from the gelatinosa, will go into the white matter of the spinal cord where they ascend upward to reach the thalamus. Then they again relay in the thalamus, and the third order neuron will go into the cerebral hemisphere. So that's why we have an order neuron system taking the information to the different part of the brain depending upon what tract are we talking about. So guys, the substantia gelatinosa, I'm writing here, substantia gelatinosa, it has major concern or major relation with the spinothalamic tract. In fact, I would request you to remember it better with this way, that pain and temperature mainly comes into the spinothalamic tract. I'm just talking about the mainly come into the spinothalamic tract. That doesn't mean nothing else can come in. Nucleus proprius is the one which will carry the touch, pressure, vibration, conscious proprioception, stereognosis and all that. I mean, when you think about the other sensation, most of them are going into which one? They're going into the nucleus proprius. Touch, pressure, vibration, conscious proprioception, stereognosis, they all come into the nucleus proprius. And that's why it is the largest nuclei. You can see it's a huge nucleus which tells you that many information are going to come inside. And nucleus dorsalis have a special relation to the tracts going into the cerebellum. And what tracts goes into cerebellum? Spinocerebellar tract. What type of information? Unconscious proprioception. Unconscious. So unconscious proprioception are bound to go into the nucleus dorsalis. In some books, they write it from the name of the tract. They say spinothalamic tract is related to substantia gelatinosa. Well, I'm saying the same thing only, but I'm trying to make it in a more conceptual way by telling you that what sensation, pain and temperature predominantly goes into substantia gelatinosa. Whatever tract it is carrying it, we'll discuss that. Touch, pressure, vibration, conscious proprioception, stereognosis, all they are going into the nucleus proprius, whichever tract is carrying them, whether it is a part of dorsal column tract or it is a anterior spinothalamic tract. If they are carrying these sensation, they are coming into nucleus proprius. And conscious proprioception was there, and unconscious proprioception which goes into cerebellum, they first goes into nucleus dorsalis and then somehow from there they reach the cerebellum, which we will eventually discuss. So it's better you remember that with the sensory input point of view. How exactly the sensation comes inside, how second order neurons is formed, how they decussate, they reach the thalamus and so on, all that story we will discuss after this. Now coming to the lateral side, guys, in the lateral side we have this lateral horn, and lateral horn is also having nuclei. Well, there are again two nuclei in the lateral horn. We have a medial and the lateral nucleus there inside. We don't have to worry about it. Just remember there is a nucleus called as the intermedio nucleus. This is intermediate nucleus of lateral horn. Now, why I'm stressing so much on this? Because we have intermediate nucleus in the ventral horn also. But this is the intermediate nucleus of the lateral horn. And this intermediate nucleus of the lateral horn, as I said, it is autonomic. It is autonomic. That means the nerves which will come out of it, they are either sympathetic in nature or they will be parasympathetic in nature. Again, you have to go back into the head and neck part and think about it, guys. When we said sympathetic or parasympathetic outflow, what was parasympathetic outflow? Craniosacral outflow. Craniosacral, that means cranial nerve and sacral nerves are parasympathetic. We already know which cranial nerve, 3, 7, 9, 10. We're done and dusted with that part. Which sacral nerves are parasympathetic? S2, S3, S4. So, S2, S3, S4, and which spinal nerves are sympathetic? Thoracolumbar outflow, and thoracolumbar outflow means T1 to L2. From T1 to L2 nerves, when they come out, they also have a sympathetic function. In a different words, what I'm trying to say here, that if you take a section of the spinal cord in the mid-thoracic region, let's say if I cut a spinal cord in the mid-thoracic region, and I'm looking at the spinal cord, and I look, there is a lateral horn present in it. So I have to presume, because the section is taken from the mid-thoracic region, so that lateral horn there must be giving rise to what neurons? Sympathetic neurons. But if I take a section of the spinal cord from the segment where we have a parasympathetic neuron like S2, S3, S4. So if I take a segment of the spinal cord from the lower part, from the sacral segment of spinal cord, I again will see lateral horn over there, but this time these lateral horns are not giving the sympathetic, they are giving off these parasympathetic nerve S2, S3, S4, the parasympathetic nerve, the nervi erigentis. So that means intermediate nucleus is not present everywhere. You have to think about that where the section is taken from. Imagine if you take a section of spinal cord in the cervical region. So obviously there is no lateral nucleus there. There is no lateral horn there, because it is either in the thoracolumbar region T1 to L2, or it is in the S2, S3, S4 region. Cervical region obviously is not having the lateral horn. And finally we come to the ventral horn nuclei, guys. Ventral horn nuclei, obviously ventral horn is motor, so whatever nuclei are present there, they will be giving rise to the lower motor neurons. There we go. Let's say these are all motor nuclei. So usually we have 3 motor nuclei. I mean, in total or maximum there are 3 motor nuclei are present, and they are named according to their location. Like this one is present more toward the lateral side, so we call it lateral nucleus. Lateral nucleus of ventral horn. Right now we're talking about what? We're talking about the ventral horn. This here is the intermediate nucleus. This was I was talking about. Don't confuse this intermediate with that intermediate. That is the intermediate nucleus of lateral horn. This is intermediate nucleus of ventral horn. And here we have medial nucleus. It's quite sure that all of them will be giving rise to some motor nerve. So we have some motor nerve will be coming out of this lateral horn, some motor nerve will be from this intermediate, and some motor nerve will be coming out from this medial. Now depends upon what where those nerves are supplying. And again, these alphabets will give you certain hint. Guys, L for lateral and L for limbs, M for medial and M for midline or axial. So when you think of lateral nucleus, think of what muscles? Limb muscles. All your limb muscles are supplied by the lateral nucleus. This we all know, that the motor neuron will come from the ventral horn and will supply the limb muscles. Obviously, motor neuron is coming and supplying the limb muscle. But where exactly it is coming from? In the ventral horn, it is coming from the lateral nucleus. L for lateral, L for limbs. Remember that. Now, M for medial, and that will remind you of M for midline. Midline means axial. Axial muscles. Axial muscles are supplied by the medial nucleus. Axial muscles like abdominal muscles, intercostal muscles. So all these muscles that we have in the axial part of the body, they are getting their lower motor neuron from the medial side of the nucleus. And think about this intermediate nucleus, guys. The intermediate nucleus, first of all, it is not present everywhere. You will only see the intermediate nucleus present in the cervical region. So that means the nerves which are having origin in the cervical region can only come out from intermediate nucleus. You will see 2 important nerves which are emerging from the lateral intermediate nucleus. One of them is the spinal accessory nerve. I hope you remember this one. Spinal accessory nerve. And the other one is the phrenic nerve. Well, both are definitely very important. The phrenic nerve. Phrenic nerve. If you remember, what was the root value for the spinal accessory nerve? C1 to C5. C1 to C5 is where? In the cervical region only. And phrenic nerve root value is again C3, C4, C5, which is again in the cervical region. So from this intermediate nucleus, which is present in the ventral horn of the cervical part of spinal cord, 2 nerves comes out. One is spinal accessory nerve and one is the phrenic nerve. So this is about the Greymater part, in which we saw what are the nuclei present in the dorsal horn, what are the nuclei present in the ventral horn, and the nuclei present in the lateral horn, and overall what type, like sensory nucleus, what type of sensation goes inside, which tract will bring it, we'll discuss that. Intermediate nucleus is about the sympathetic and parasympathetic, thoracolumbar or sacral outflow, and lateral horn nucleus, ventral horn nucleus, we have three part: lateral, intermediate, medial, and they are supplying the muscles of the different region. In fact, I remember they gave a question once. It was an image-based question in which the magnified image of the ventral horn of the spinal cord was given, and there was an injury shown in this part, very much in the lateral part, somewhere here. So it was a close-up picture of the ventral horn of the spinal cord, and the injury was shown toward the lateral side. And the question was something like this: that which of the following muscle is most likely to be involved in the following lesion? So, well, obviously, you know that lateral horn means what? Limb muscles. So, from the options, I just have to choose the limb muscle there. Because the rest of the muscles, the examples were pretty simple. Like the diaphragm was given, intercostal muscle was given, rectus abdominis was given, and there was a lower limb muscle, like quadriceps femoris was also mentioned, and that will be the answer. So, if the injury is toward the lateral side, limb muscles will be affected, medial side, axial muscle will be affected, and if there is an injury to the intermediate nucleus, which is only in the cervical region, then there will be involvement of the sternocleidomastoid, trapezius, and diaphragm, supplied by phrenic nerve and spinal accessory nerve.